Okay guys, so I am continuing from my video from yesterday where we went over the second part of SimChart submissions and we stopped at the special charts section. So when you log back into SimChart, so if you started it and you weren't able to finish it, but you came back to it the next day, then you're gonna get to the screen and make sure that you click on return to previous session with saved patient information. Otherwise, if you click this one, then you're gonna lose everything that you did on your last one. So I'm gonna hit start, and it has all of the information saved that I did yesterday. So to go back to where I was, I need to get to my special charts section. And I just wanted to point this out because if you did your systems assessment the way you were supposed to do it, then you will see that your Morse-Fall scale and your Braden scale is already included in this area. So here's your Braden scale, and I'm just going to hit back. Oops. And your Morse-Fall scale should be here, maybe under musculoskeletal. Let's see here. Maybe safety. I'm not sure. Oh, here we are. So Morse-Fall scale, and then the scale will pop up for you to do it here. So we should have already done all of that in our systems assessment here. So it's not really necessary for you to go in and add that here again. Now, I wanted to point it out though, because if you do have a patient that is on a neurocheck, or we're doing the Glasgow Coma scale, geriatric depression scale, or the CWA protocol for alcohol withdrawal, then you would go here to special charts to add those different types of scales. Next, we're going to go to wounds, and it's very important that you document your patient's skin assessment. So this is cool because it lets you document it on the patient. Say they have some heel wounds, and you can say whether it was healed, and it changes it to green. If it's, you can type, where it's at, whatever. And say it's a pressure ulcer, stage 1. Now, as nurses, we are no longer allowed to stage wounds, but it's still important that you understand, the different types of wounds. If it's an official wound, then a wound care nurse has to be able to stage it, but we should be able to identify what type of wound it is. And you just need to go in and do your assessment. And then interventions is important because it's what did we do for that wound. So, and education should always be part of your intervention. So educating the patient, you can encourage them, and if education is not there, then you would document it. Education provided on importance of pressure reduction techniques. And then we're going to click here, no complaints at this time. And I'm going to save that and move on to IVs. The patient I added this already because I actually already recorded this part and I wanted to just kind of breeze through the rest of this. So I added that the patient had a right AC. We inserted a peripheral line over the needle catheter. It's a 20 gauge and we only put it in once. Assessment of the skin. This looks exactly like the assessment or documentation that you'll see in the hospital setting as well. So it's very good for you guys to get comfortable with all of this because you will see it again, I promise you. Even though it seems redundant, you will see it again. For drains and tubes, this I mentioned here, I wanted to mention here the Foley catheters. So in a lot of the clinical settings within Baycare facilities, they will have these external, they're Foley catheters, but they're not indwelling. So we still need to document on them because a lot of the times they will have suction set up to them. But they can still put the patient at risk for skin breakdown or pressure ulcers. So we need to make sure that it's documented. And it's just connected to a Foley bag and the patient's tolerating it. And we still need to do pericare on these patients and still follow the hospital protocols when it comes to Foley catheters. Same thing with ostomies. You can go in and you can click where the ostomy is, and then the same thing with injection sites. For vital signs, we're going to go in, and I added these vitals here, so you just type in what your vital signs are and hit save. Same thing with INO. I went ahead and added the PO fluid intake, and I added the IV fluids, normal saline with 20 of K, and the patient ate 100% of their breakfast, and the urine voiding is volume versus frequency. So if the patient goes to the bathroom 3 times on your shift, then you would document 3 times. And you just simply ask the patient how many times they went to the bathroom. If they were using a Foley, or a hat or a urinal, then we would be able to determine volume. So that is the difference with that. And then height and weight, I went ahead and added that as well. Pretty straightforward when you get to this section. So not a lot of detail that, you can't figure out on your own. So we're going to come over to SimChart. We're going to highlight this and get this out of our way. And then the next section is going to be order entry. And this is just so that you can see the different types of orders and get very familiar with them, because you're going to have to see them eventually whenever physicians give you orders and you have to put them in the computer. This is really nice because it makes you think about what it is that you're having to put in. So the example that I used was a CT of the chest, and when you click on the category, it pops up and you have to figure out where each section or where each test fits. So if it's a CT, I'm going to pick X-ray. I'm not 100% sure if that's what is listed under, but I'm guessing so. And sure enough, CT, chest with contrast, and these are orders that get put into the system whenever you're working or whenever you're at clinical. So these pop up during the day and you have to acknowledge these orders, and then we have to send the patient down. So whether it's physical therapy, whether it's a CT, or whether it's blood work or a new medication, then this is where you would go to add all of these types of things. So let me just finish this order so it lets me close it out here. Sorry if the sound is kind of weird with my computer. It's the mouse I'm just using on my laptop. So okay, so for pharmacy orders, this is kind of interesting too because it has every medication that you could possibly imagine. Let's type in morphine. I guess we can use Dilaudid. Routine, or we'll say PRN. Let's do PO. 1 milligram. It's going to be a tablet. As you can see, there's literally every type of option you can possibly think of. Let's say Q4 hours. I don't know what that option is. Four times a day PRN, we'll say. Now the order stop date is if it was like a one-time order or times 2 doses, things like that, then, or you only want the patient to have the Dilaudid for 2 days. Now the doctor will specify all of this and it'll be listed in the order. So you shouldn't have to be making things up here. It should be listed for you. Now the cool thing is all the orders that I've put into the system are right here. And then I'm going to submit my orders, and it breaks it down for me so that I can see all the orders that I put. Now for order results, let me go back real quick. Your diet orders need to be in here as well. So if the patient is NPO, then they need to have an NPO diet order in here. If they are on a clear liquid diet, then you can put clear liquids. Start the order, date and time. This doesn't really matter, so don't get too caught up in all of the dates and times of things, just because we're just trying to see that you can put the order in and understand what it's for and why you're doing it. Now, order results. If you ordered something for your patient and the result and the test was completed, then this is where you would go to input your results. So let's see here. Say we got the results back and we wanted to document what the results were. Now, if you have a test that is pertinent to the patient and it is significant for their diagnosis, then that's how you get to put the results in here. You have to go in, you have to add the order, and then in order for you to do the results, then you need to add it in here. I'm not sure if that made sense, but let me go in, for example, and let me add a lab. So for lab type, we're going to do, let's see, can we do a hemoglobin maybe? Okay, and say we did a stat hemoglobin one time. The order was on the 3rd, and we'll just pick a time. Specimen is blood, add order. Okay, so my order is there, but in order for me to go in and show you what the results are somewhere, then you have to add it into this section, and then when you go to order results right here, it's going to show it on my orders set that I put in. Now you have to add the result, and this is really cool because it has it listed for you, and it tells you what the normal ranges are for male and female. So for this, I'll say 7, just to show that it was critically low, and that the result is, it was resulted. For the CT, the same thing. You can get this from the results section in Cerner in the patient's chart at the hospital, and you can write what the report said, the impression, what the recommendation was, and then who read it. Okay. Now, for patient card, this is just has what all of the orders, like the really important orders that are available for your patient. So it's kind of like your order section. Your MAR, your medication administration record, this is going to have all the meds that are ordered for that you put into the system for your patient. So here's our Dilaudid. This is a high alert medication. This populates for us, and then it pops up this clinical pharmacology sheet, which is amazing for you guys because you don't have to do a lot of research. You can still use your drug book, but this is really cool, and actually I just discovered this. Makes me really excited. It tells you what the description, the classification is. It tells you everything right here. The contraindications, the mechanism of action, pharmacokinetics, and when you go into your SimChart to do your medications, that's what you're going to be putting into your, let's see, where are you? Preclinical manager here. So preclinical manager, your medications here that we did already, this is what you're going to put here. So it's literally here for you. You don't have to go, Googling things or looking through your book. I mean, you can, but it's very conveniently located right here for you. And I just love that about this, because this is just, that's how you learn. So I'm going to close that. Enough about that part. Now, the next section here I'm going to add is, I'm going to highlight this out, the patient data information, because the care plan section here I'm going to leave for a completely different video, because that is one that a lot of students have questions on. So I'm going to go into a lot of detail here. So I'm going to close with the allergies and health history and just point out that in the patient data tab, you can go in here, add your allergies. I added penicillin. If the patient had any other allergies, you can add, seasonal allergies. We'll say latex, or environmental allergies, latex. And then we'll just say itching and hives, mild, and then the patient reported it, if they were reliable or not. Okay. Now, home medications, at this level, you don't need to really get into, because this is what the patient tells us when they come into the hospital. And this is what the doctor uses to do their medication reconciliation. So the nurse puts in their home meds into the system. The doctor comes here, does the med rec, as we call it, and they convert the medications to inpatient. So for the sake of being simple and just getting you into the habit of learning the medications, we are just more worried about the preclinical manager medication section, and then the MAR, the MAR. And then health history, you can go in and add if the patient has a history of things that may be pertinent to their medical diagnosis. But, some patients have millions of different diagnoses and prior surgeries, things like that. So don't get too caught up in all of this part, but if it's pertinent and it relates to the diagnosis, then definitely add it. Okay, so for this, I think that's about it. The next section, I'm going to be going into care planning. Oops, I'm sorry. Let me see something here. We'll go over this in the care planning section. So care planning is what we're going to be doing next, so you'll be seeing that in the next video.